As you've learned, chest compressions alone are very beneficial to a patient who is unresponsive and not breathing normally. However, if you are also willing to provide rescue breaths to a patient in need, you may further increase the patient's chance for survival until emergency medical service personnel arrive. After completing this skill, you should trust your training and provide an unresponsive patient who is not breathing normally with complete CPR, chest compressions, and rescue breathing. As always, begin by assessing the scene and give your responder statement.
Hello, my name is Juanita. I'm an emergency responder. May I help you?
Next, tap the patient on his collarbone and ask,
Are you okay? Are you okay?
After you deliver your responder statement, quickly open the patient's airway and check for normal breathing. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. As in the previous skill, find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers, like this. Now, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows. Now deliver the chest compressions. Keep the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters, 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. After delivering 30 chest compressions, quickly position a ventilation barrier on the patient and open the patient's airway. To open the patient's airway, you will use the head tilt chin lift. First, place your hand on the patient's forehead. Next, apply firm backward pressure with the palm of your hand, tilting the head back, like this. Place the fingers of your other hand under the bony part of one side of the lower jaw near the chin. Avoid pushing directly under the chin. Lift the jaw upward to bring the chin forward. This immediately opens the airway. Now, with the patient's head tilted back and the ventilation barrier in place, begin your rescue breaths by pinching his nose closed. Give 2 rescue breaths, with each lasting about 1 second. Provide the patient with just enough air to make the patient's chest rise. Look for this rise in the patient's chest. If you can't make the patient's chest rise with the first breath, repeat the head tilt chin lift to reopen the airway before attempting another breath. Improper position of the head tilt chin lift is the most common cause for not being able to inflate a patient's lungs. Do not try more than 2 rescue breaths to make the chest rise. Minimize delay between chest compressions. After 2 breaths, whether they make the chest rise or not, begin chest compressions again. After delivering 2 rescue breaths, immediately begin another cycle of 30 compressions. Continue alternating 30 compressions with 2 breaths until emergency medical service personnel arrive. You can defibrillate using an automated external defibrillator. The patient becomes responsive and begins to breathe normally. Another emergency responder arrives and takes over your CPR efforts. Or lastly, you are too exhausted to continue. If more than one emergency responder is present, consider alternating care. To avoid fatigue, each provider can deliver CPR for 2 minutes and then switch. While switching providers, minimize chest compression interruptions.